Hey guys, this is Dr. Marwah.
Hello everyone, this is Dr. Nikita here.
In this video, we do a quick analysis of the last two NEET papers. We'll divide this into two parts. The initial part would be how many MCQs were asked for a particular subject. Then we're going to talk about the subtopics asked in 2021 in comparison with 2022.
These are the recently asked topics, and they give you an insight into what are the favorite topics with the examiners, what topics are being asked in the recent years repeatedly. So we would see that subject wise, we would see the subject weightage, and also the important topics in each subject.
And the consolidated list of the entire subtopics for 2021 and 2022 would be available in a PDF format in the Telegram group of PrepLadder.
So let's get started with it. If you look at the first year subjects, that is anatomy, physiology, and biochemistry, on an average, you see that this is NEET PG 21 is around 24 questions. This is around 21 questions. So we can expect around 25 questions, like 22 to 25 questions from the first year subjects, that is anatomy, physiology, and biochemistry. Now, even in the subjects, what are the topics that we should be focusing on? So in anatomy, like there were 7 questions and 5 questions respectively in NEET PG 21 and 22. The topics that have been asked are cranial nerves is a favorite with the examiners. So in NEET PG 21, there was a question on glossopharyngeal nerve. And here we see that in NEET PG 22, there was a question on trigeminal nerve. Right. So please read the cranial nerves very, very well along with the various foramina through which these cranial nerves pass. Then we had a question on nerve injuries, upper limb, lower limb. There was a question on musculocutaneous nerve injury. Right. There was a question on saphenous nerve injury, which was also asked in NEET PG 22. So nerve injuries is an important topic, and integrate it with orthopedics, the various tests for the various nerve injuries. Then we had a question on tongue anatomy, the histology question, circumvallate papillae. The types of cartilage was another question from histology. So one question from histology maybe we can expect. So types of cartilage, the question was, there was an image where you were given the chondrocytes arranged in a row. So what type of cartilage is it? It is a fibrocartilage. Okay, it's a fibrocartilage. Then the next topics that we had was salivary glands anatomy, the nerve injured with submandibular gland injury, and circle of Willis and mesentery, ventral mesentery, dorsal mesentery. What are the derivatives of the ventral and the dorsal mesentery? So embryology, one question is what we can expect.
The number of questions that have been asked in physiology is almost constant, 6 versus 7 in 2021 and 22. In 21, he talked about glucose transporters, linkage with ORS, that's SGLT1, then Sigurd-Anderson normogram, that would be kidney and its role in acid-base balance, then fluid compartments, pretty standard data. For hyponatremia, you very well know that, if it's acute hyponatremia, you can give a fast correction. If it's a chronic hyponatremia, then you should do a slow correction primarily because of the risk of osmotic demyelination syndrome. I mean, in acute scenario, 100 ml or given over 100 ml of 3% saline given over 10 minutes bolus would be sufficient. But in a chronic variety, you need to give it really, really slow. Then in multiple sclerosis, he has talked about conduction block, and this conduction block can be affected by temperature as well. So you have a Utto phenomenon coming up, and then the standard information for second messengers. In 2022, was talked about desmosomes and hemidesmosomes, so intracellular connections, nerve fibers and its subtypes, then about these involuntary movements which are related to the basal ganglia, the Seddon and Sunderland classification for nerve injuries, hypothalamic centers and baroreceptors and chemoreceptors. So pretty straightforward data, I think, and if you're spot on with this, you'll score pretty decently. I think at least 5 out of 6 can be obtained correct, or 5 out of 7 can at least be correct from physiology perspective.
So we have 12 questions and 20 questions in the past 2 years in biochemistry. And in that, you would see that vitamins is very favorite. There's vitamin A in both the years. Then there is a question on vitamin B3 as well, vitamin B12 as well, right? So vitamins, again, there's a question on Pallegra. So we have seen in all the exams that vitamins is a favorite topic from biochemistry. Then in biochemistry comes the inborn errors of metabolism. Like you have the lysosomal storage disorders, the glycogen storage disorders, right? Then you have homocystinuria, alkaptonuria. All of these are very, very important. Dyslipidemias. So in biochemistry, we should be focusing on this. Electron transport chain has been asked in both the years. So please master especially the electron transport chain inhibitors. So for example, if I ask you that BAL, that is BAL, dimercaprol, is an inhibitor of which electron transport chain complex? So remember, BAL is 3 alphabets. So that is the inhibitor of complex 3. Cyanide is which electron transport chain complex inhibitor? So remember that all the compounds ending in IDE, like cyanide, azide, hydrogen sulfide, all of these are complex 4 inhibitors. Okay, all of these are complex 4 inhibitors. Pellagra, which is vitamin B3 deficiency. From which amino acid is vitamin B3 derived? So remember, B3, 3 is tri. So remember, it is derived from tryptophan. B3 is derived from tryptophan. Okay, that's tryptophan. So look at the other topics that have been asked. We have a question on glycolysis, glycogenolysis, right? Similarly, there was a question on glycogen storage disorders. So focus on vitamins, electron transport chain, the inborn errors of metabolism in biochemistry, very, very important. Next, now going on to the second year subjects, what do we have in the second year? So patho, pharmac, micro and FMT. The number of questions that you see here is like approximately 40 to 50 questions is what we can expect from these 4 subjects. So these are very, very important. 40 to 50 questions out of 200. That's a major chunk there. So please focus on these subjects as well for your exam in the last days. So in pathology, 15 and 10 questions in the last 2 years. If you look at the topics distribution, hematology is something which is very, very important. There's a question on AML, then there's a question on CML, iron deficiency anemia, megaloblastic anemia, there's a question on CML, non-Hodgkin's lymphoma, aplastic anemia, follicular lymphomas, right? So hematology along with leukemias and lymphomas is very, 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 very important topic in pathology. Next that we have in patho, the general part of pathology, carcinogenesis, acute inflammation, right? All these again are very, very important. So most important, if you ask me, in pathology, that's going to be the hemat part specifically, which is extremely, extremely important. So please do that very, very well, right? The AML, CML and the various lymphomas, iron deficiency anemia, then you have megaloblastic anemias, multiple myeloma. All of this is important. Okay, all of this is important. Then going on to the next one, that is pharmacology. So in pharmacology, you would see questions which we have seen here on osteoporosis bisphosphonates that we have seen is being asked in the recent years frequently. Enzyme inducers, enzyme inhibitors. So is the interaction of like ocipil's failure. Which TB drug when given to a patient will lead to ocipil failure? Like rifampicin, because rifampicin is a enzyme inducer, right? So all of this is important. Teratogenic effects of drugs has been asked in the recent years. General pharmacology is something that you should read well, right? The formulas for loading dose, maintenance dose, therapeutic index, the dose response curves, all of these are very important. The general pharmacology part again. So like you have ADRs per question. Digoxin toxicity we have seen has been asked many times. Hypokalemia increases the digoxin toxicity. We should always remember that, right? Diuretics, again, this topic, the site where the diuretics act, like the loop diuretics acting on the thick ascending limb, then you have thiazides on DCT. All of this is very, very important. ACE inhibitors, again an important question there. So ACE inhibitors, ARBs, all of these are important. Then you have the antimicrobials, macrolides, metronidazole, antiprotozoal, rifampicin. All of these are important, right? All of these are important. Now going to the year 2022, there's a question on this warfarin, adverse effects toxicity. So some drugs toxicity which is very, very important like digoxin, warfarin, phenytoin, lithium, like these are the ones which are very frequently asked. Oral anti-diabetic drugs, right? Remember the adverse effects, again, very, very important. AKT drugs like rifampicin, isoniazid, very frequently asked. Again, the digoxin toxicity has been asked here as well, right? So make sure you are reading the topics which are asked frequently and you are not missing out on those. Now, going on to the rest of the topics in pharmacology, methotrexate is another important and a frequently repeated topic that we have seen, and so is the topic of corticoids. Rheumatoid arthritis ke drugs, gout ke drugs. These are also very frequently asked.
Next up is microbiology and forensic medicine. The number of questions in micro have remained almost the same, and I anticipate about 15 or so questions would be asked. For forensic medicine, which I think is more of fact, so nobody will have a problem. So the real challenge is microbiology, and nobody makes a mistake with respect to antigen antibody reactions, staphylococcus aureus. It's just that the bacteriology component is so vast that the fatigue factor sets in, that by the time you start reaching up to Legionella, or when you start reaching up to chlamydia, rickettsia, that's when people tend to falter. So my suggestion to you would be that you should start your revision of microbiology in a reverse fashion. You should do parasitology, then mycology, virology, and then move on to bacteriology. And even in bacteriology, go in a reverse fashion, though this is an individual choice, but that would be my suggestion as far as covering microbiology is concerned. And yes, if possible, if time gives you a permission, then please go through the infections component in the medicine section as well. I've been very selective in some of those topics which have been very frequently asked in the exam, and especially opportunistic infections in AIDS. I know you're very thorough with it, but just to get an overview of the fact that are you really, really good at that microbiology component, just listen to that at maybe 1.8 or 1.2x opportunistic infections in AIDS. That's the last video in the medicine section, and that would give you a fair amount of idea about how would you be proceeding. Just skip through the initial part, no need to go into the details of the HIV virus, but especially where the opportunistic infections have been discussed, I would suggest you to go through that. It would take about 1 hour of your time, but would give you a fair amount of idea with respect to how would you be standing with respect to the questions, which would be 2 or 3 liners, where he'll try to trouble you with lots of data which might have to be just skimmed through, because most of these would be facts. As far as forensic medicine is concerned, it's standard data, asphyxiation, drowning. So I think almost 100% score can be obtained in forensic medicine. If not 100% score, you should target at least 80 to 90% considering the competition that you're up against.
Next, now coming to the third minor subjects, Opthal, ENT and PSM. The number of questions that you see here, this is like 14 plus 17, around 31 questions. And this you have around 27 questions. So we can expect 25 to 30 questions from these subjects as well. Predominantly majority questions being from PSM, right? So whenever you have subjects which are more fact-based, memory-based, make sure you are learning mnemonics. You are using mnemonics to remember those subjects. So in ophthalmology, let us see what are the topics that have been asked. Glaucoma, any question from glaucoma, one question from glaucoma is what we generally see, like angle closure glaucoma, congenital glaucoma, that is important. Visual field defects again is another favorite with the examiners. So when you have pituitary lesion compressing the optic chiasma, that leads to bitemporal hemianopia. Right, so remember that pituitary lesions, bitemporal hemianopia. Astigmatism, then you have diabetic retinopathy that has been asked in both the years. Right, retinoblastoma is important. So glaucoma, then you have keratoconus, visual field defects, diabetic retinopathy, and of course refractive errors. These are very, very important from ophthalmology. Going on to ENT, the subjects which have less number of questions, the topics being repeated, the chances are less in that. So you would see that not many topics would be repeated here. So one is like otitis media, maybe CSOM or ASOM. Otitis media is important in ENT. Atrophic rhinitis, tonsillectomy, vocal cord palsy is important. Then you have nasopharyngeal angiofibroma, right? These might not be asked every single time, but these are asked very, very frequently, right? Going on to the next one that we have is PSM. PSM again is a subject that you should do very well. You would see quite a few questions from that subject, and it's a scoring subject again. So what do we see in PSM? Biomedical waste management is important. A question on vaccines is important, right? Frequently asked there. Primary level of healthcare again is asked frequently, right? Then you have relative risk, attributable risk, all of those, which is important. The epidemiology part is very, very important there. And then you have a wide variety of topics in PSM like malnutrition, air pollutants, sterilization and disinfectant, vaccines. We have already said it's very, very important. National immunization schedule, the vaccine types, right? All of these is important.
Next up are the big three: medicine, surgery, and pediatrics. And the distribution of the number of questions asked for these subjects have been fairly consistent over these 2 years. And as far as medicine is concerned, there were no surprises. I mean, standard information was asked in both 21 and 22. They are trying to see how is your approach overall to the subject. So standard, I mean, bread and butter data, I can say pneumonia, congestive heart failure, or hepatorenal syndrome, or let me say sarcoidosis, aortic dissection, hyperkalemia. There are a couple of them. I'll not bore you down by just saying the names of those topics, but my suggestion to you would be, if you have Rapid Revision 4.0, you would be having, let me say, 30 hours of data at your disposal. So if you can listen to that at 1.5x, I think you'll be good to go as far as I would say your preparation for the current exam is concerned. Coming to the surgery part, you'll notice that at least one question on the pneumo component will always be there. It's either going to be pneumothorax or pneumomediastinum or pneumoperitoneum that's asked to you. Then trauma part is always asked. And most of the time I find people are very good with the esophagus, stomach, and then subsequently the fatigue factor comes in. So I want you to be good at staging prostate cancer, staging colorectal cancer, or even if you don't remember the staging part, as far as the management perspective is concerned and the diagnostic parts are concerned, you should be good with that. And surprisingly, you will notice that urology component, we again, because we allocate about 3 days to surgery, so urology component is usually given a lesser number of hours. But if you go through the list, you'll notice that the urology component has been substantially asked in both 21 and 22. Like bladder cancer, I mean, has been asked always. So it's always a good idea to go through these topics so that you are fighting fit for the actual D-Day. From the pediatrics domain, malnutrition, infections, then Duchenne's muscular dystrophy, congenital heart disease, tumor lysis syndrome are a couple of topics that will be asked. Meningitis will have an overlap with the, I would say, medicine. He can talk about tubercular meningitis, especially in pediatric age group, or a viral meningitis in a child, and the CSF picture would be given to you. That's again standard, and then you'll have to analyze which kind of meningitis is present in a patient. Similarly, types of seizures, especially neonatal seizures, can be asked before you. It could be pyridoxine deficiency, it could be accidental injection of lignocaine into the scalp of the baby while the episiotomy was being given. So I mean, there are multiple reasons why neonatal seizures can occur. It's a huge topic, so you need to be thorough with that. And then standard nephrotic syndrome, minimal change disease, Finnish variety of nephrotic syndrome are a couple of topics which I would like you to be thorough with. So I think if you take care of these big three and allocate about something like 8 to 9 days, I know that it would sound a little far-fetched that you can finish all three in 9 days, but yes, I think it is possible. And if you are able to finish that, I mean, I know it's a difficult task, but if you're able to do that, you are properly aligned for the D-Day and the battle which is bound to come.
Now, coming to the final year subjects, so the major subjects, that is medicine, surgery, peds, and OBGY, they form a major chunk of the paper. But actually, it's very, very difficult to categorize the questions into like one subject because there's a lot of overlap in the topics that you would see. Like radiology question, an integrated radiology question, it can be put into medicine and it can be put into radiology as well. So these major subjects you see are very, very important. And then you have the short subjects, the SARPO subjects, that is skin, anesthesia, radiology, psychiatry, and ortho. Again, which have a good number of questions, like 25 to 30 questions from these short subjects as well. So the number of topics that you need to read in this short subjects is limited, and actually they are scoring. So try to finish off these short subjects first so that you know that you have gained those 25 to 30 marks already, questions already in the exam. Going on to the topics that have been asked in these subjects. OBGY, 20 to 25 questions. That's a huge number coming from one subject. So make sure you master this subject very, very well. So what do we have here is Mullerian duct anomalies, right? Mullerian duct anomalies has been asked. integrated with radiology, like what investigations, HST image is given, you are asked to identify the anomaly. So Mullerian duct anomalies is important, preeclampsia is important, PPH is important and frequently asked. And then we also have the various malpresentations like the breech presentation. Here you would see the occipito-posterior position, right? The malpresentations are also very, very important. Then you have the pelvic anatomy and the pelvic diameters, the various scores in obstetrics, which are very important. Molar pregnancy, right? Engynac, fibroid is important to be read. MTP, all of these are very, very important. Contraception, of course, not to be forgotten, like IUCD, OC pills, all of this is important. Then you have ectopic pregnancy, again, which is a frequently asked question. Labor case stages, partogram, right? The third stage, the first stage of labor, all of that is important and should be done very well. So in obstetrics, basically the malpositions, then you have labor, then in gynac there is fibroid, contraception, all of this is important. PCOS, obstetrics may preeclampsia, PPH, these are like the must do topics, right? Going on to the next one, orthopedics. Now again, when I said, the shorter the subject, there are less chances that the same questions would be repeated, because there are so many topics from where the questions can be picked up, right? So it's the chances are less ki 21K questions 22 mein aayenge, 22K questions 23 mein aayenge, particularly in the shorter subjects. So for the shorter subjects, I would recommend that you also see the previous year papers, like the last 3 years, 4 years, 5 years papers. From there the chances of being repeated are more. So what do we see in orthopedics is there was a radiograph of scurvy. So scurvy versus rickets, important radiograph. So ortho radio integrated question. Ankylosing spondylitis, again integrated with radiology. Elbow dislocation, posterior hip dislocation, again elbow dislocation. So maybe one joint dislocation is what you see in the exam frequently. Nerve injuries we have already seen in anatomy. So integrated with orthopedics, the various tests, right? The pen test, you have the book test, the card test, all of those. So remember those P-wala test, like the pen test, the Pope's benediction, then you have the ape thumb. All of these, the P-wala test are basically for the median nerve. So pen test was asked in NEET PG 21 as an image-based question. One of the bone tumors, like giant cell tumor, is asked so many times in the exam. So epiphyseal bone tumors, giant cell tumors. So bone tumors is important. Dislocations are important, right? The nerve injuries are important in orthopedics. They are very, very important. Next, we have coming to radiology. Now, you would see that radiology questions are not like, what is the diagnosis? A clinical history generally is given, integrated with the image. So many times the history itself is enough to make a diagnosis. So do not get scared if you're not able to identify a radiology image. Try to focus on the clinical history. Right, so for example, when in a patient of trauma, there is hyperresonant node given and a chest x-ray image is given. Hyperresonant means air. So remember that it is pneumothorax. That's an indirect clue to identify pneumothorax, though you might not be able to identify the radiograph. So radiology questions are more integrated. There was a straightforward question on TAPVC, the snowman heart, right? Remember the figure of 8 heart, like you have snowman heart. Remember the snow falls from above, that is supra. So that is supracardiac TAPVC. Okay, supracardiac TAPVC. Then you have a question on intestinal obstruction, psoas abscess. In the recent years, we have seen that one question on radiosensitivity, radioresistance of various tissues is asked. Remember the law of Bergoni. The more actively the cells are dividing, they are more sensitive to radiation, right? So neurons are least sensitive. The gonads, bone marrow, intestinal epithelium is sensitive to radiation. One question on pneumothorax or pneumoperitoneum is what you would frequently see in the exam. One question on identifying the investigation, like the PET image was asked, Doppler image was asked. Identifying the investigations, MRCP, ERCP, how do you differentiate them? All of those is important as well. And now coming to dermatology. So in dermat, like 5 to 6 questions on an average in dermat is what we can expect. So in dermatology, leprosy is something which is very, very important. Alopecia is a frequently repeated topic again, right? Acanthosis nigricans ka image based question, right? These are important. Psoriasis is important. Pemphigus vulgaris, the vesiculobullous disorders, like these are the most important ones in dermat, if you ask me. So these are very, very important topics in dermatology. Next, what we have in anesthesia, maybe 2 questions, 2 to 5 questions is what we expect here. Capnography is something which is very important. The oxygen delivery systems, ventilation is something which is important. Then you have the various drugs in anesthesia, right? Halothane, local anesthetics, succinylcholine, malignant hyperthermia, right? These are the drugs in anesthesia are important as well. So is the BLS, the cardiac arrest management, all of that. It's something that we should know as MBBS graduates, right? So that is why this is important to know. So again, one image-based question, a question on drugs and anesthesia is what you would frequently see in the exam. Going on to next one, psychiatry. Again, on an average, 2 to 5 questions in psychiatry. Delirium tremens is something which is very, very frequently asked. So alcohol withdrawal, delirium tremens is important. The various postpartum mood disorders, how do you differentiate postpartum psychosis, postpartum blues, right? The timelines in psychiatry are important. You know, if 1 month ka duration, then what is the diagnosis? If 6 months ka duration, what is the diagnosis? How do you differentiate psychotic from neurotic? What are the various personality disorders, right? All of these are important in psychiatry, and so are the drugs in psychiatry. You read it in integration with pharmacology, right? The antipsychotic drugs, antidepressant drugs, all of these are very, very important. So I hope this has given you an insight into what are the various topics in each subject that you should be focusing on in these last days, and make sure you master these topics. Make sure you sharpen your axe so that you are able to cut the tree very fast and very well. Wishing you all the very best for your exams. Keep studying, keep revising, and keep winning. Thank you.
Subscribe and press the bell icon so you never miss an update from Prep Ladder.